set? Okay, welcome to our Tuesday at 2 COVID-19 update. We have quite a few things to get through, and we're going to try to move this as quickly as possible. Starting with, in the last 7 days, we've had 2,175 total new cases. That's an average of 237 total new cases per 100,000 residents over a 7-day period. This has dropped. This is really good. We're very happy about it. Hospitalizations are 313 COVID-19 patients in Western New York. 89 are in the ICU. 258 patients are in Erie County hospitals. That has dropped. The only thing that's a little concerning is we are seeing an increase in the ICUs, which means these are people that are very sick. 78 in the ICU on the 25th, 55 on an airway assist, and 4 died. And we just want to thank, as always, Kendra Schmidt from being here from Deaf Access Services. And you look at in depth the hospitalization chart for the last 2 weeks. 71% of Erie County hospital beds are actually occupied as of the 25th. 30% of the COVID-19 patients are in the ICU. And you'll see that while the hospitalization number for all of Erie County has gone down, it actually has increased over the last week for the ICU. That's very concerning because those people are generally very ill. And then 61% of those that are hospitalized are 64 and under. So it's not just seniors that are hospitalized for COVID-19. As you see on the bottom row there, we have had quite a number of deaths in the last 2 weeks. Actually, the most deaths we've had pretty much since January. We'll talk a little bit more about the mortality data and what we're seeing in a moment. Confirmed cases over the past 6 weeks. I'm very pleased to see the drop in overall cases by more than 1,000 in 1 week. We saw our peak in the week that ended April 10th with 3,397 new cases in a 7-day period. We're now down to 2,285 as of the 24th. It's about 250 cases per 100,000 people. Remember, the CDC has a standard of a high risk of transmission if it's 100 or more. So we're still 2.5 times where we should be, but we did see a drop by about 1,000 cases from the previous week. So that's a good sign. And after the last couple of weeks of reminding everyone that COVID's still here and there's some really high numbers out there, we did see a drop, so I think people are taking it a little more seriously again. And the same thing with regards to by zip code. The 14215 zip code unfortunately led again, but we did see a drop in the average number of cases. It was over 800 per 100,000 people in a 7-day period. It was about 850. So almost 1% of the 14215 zip code tested positive for the week ending April 17th. That has dropped down. It's basically half of 1% tested positive for the week that ended April 24th. Still way too high. But most of the other areas have seen a drop, and unfortunately it is still the city of Buffalo that has the highest rates per 100,000. And we are concerned about that because we know that many of these people are at risk for catching COVID and getting sick based on health inequities they may have and other issues they deal with. The confirmed cases per 100,000 in the past 7 days, you can definitely see the drop in the older age categories, but we're still seeing some high numbers in youth as well as through the age of 39. So we want to remind everybody that COVID is still out there and a lot of our young people are catching it. Some of these people are being hospitalized. As you see, the older population definitely has a much lower rate. Glad to see it in the 80 above. It's less than 100 new cases over a 7-day period. There were only 41 cases in the 7 days that ended April 24th in the 80 and above. So that's a good sign. Same thing with the 70 to 79. It was only 63 cases in a 7-day period. So that's a good thing too. And it just proves that we vaccinated a lot of our adults, especially our senior population. And as a result, they have protection against COVID-19 illness, hospitalization, and in all likelihood death, though as we will talk about in a moment a little bit more about mortality data, if you have underlying conditions, even if you're fully vaccinated, there are still risks to you. We broke down the COVID-19 cases by age weekly comparison even further, so you could look at it in the 5 to 10 versus 11 to 13, 14 to 17 category. And the total positivity in these numbers is very high. Of course, we do not have the SUNY pool testing for those that are 18 and above, but we know the actual numbers for the children's age category because they're not included in SUNY pool testing. And from 5 to 10, 9% of those we tested last week in all of Erie County labs were positive. 10.4% in 11 to 13 and 12.3% in the 14 to 17-year-olds. So there's still a lot of youth in our community that are catching COVID-19 and getting sick. We have quite a number of students that are sick with COVID-19. Others are asymptomatic, but they still have it, and it is spreading. So we just want to remind everybody that it is out there, and just because you're young doesn't mean you can't catch COVID-19, nor can you spread it. You can catch it and you can spread it. Schools, in new cases in schools, we did see a drop from the week before, which was the highest we had ever seen. It went down to 413 new cases of individuals in schools, with the vast majority of these, over 90%, being students. So that's good to see a drop. It corresponds with the overall drop in the greater community. Still high, but at least we did see a drop from what was the ridiculous high total from the week ending April 17th. So we want to remind everybody that it's still out there and you can still catch it regardless of your age. Mortality data. This is something that we've been keeping track of and is a lot lately, and it's very disappointing to see more people still dying in Erie County. In the month of April through April 22nd, 60 confirmed residents have died from COVID-19. That is equal to the amount for the entire month of March. So when all is said and done, we know more people will have died, Erie County residents, in the month of April than March. And the average age of death has also dropped to 71. And as you see, we have 2 people under the age of 40 who've died in the month of April. 6 between the age group of 40 to 49. And of the 60 individuals, we have confirmed that 1 of those individuals was fully vaccinated but had significant underlying conditions. So the 59 other people who died in the month of April had not been fully vaccinated. And it just goes to show that the best way to protect yourself is to be vaccinated. Only 1 person in the month of April that we confirm passed away from COVID-19, and they were fully vaccinated, and that individual had significant underlying conditions. So get vaccinated. It protects against serious illness as well as death. With that, I'm going to turn it over to Dr. Burstein to talk about our number of responses, primarily testing and vaccine. So with that, I'll put my mask back on and introduce Dr. Burstein. We'll talk a lot more about what we're doing, including some innovative programs we have with the schools and a conference call we had with the schools this past week.
Good afternoon. So first about how we are responding. First of all, it's really important to know your status with COVID-19. So again, there is a lot of COVID-19 testing available in Erie County. There's PCR diagnostic testing. There's rapid testing. At the Erie County Health Department, we're offering both flavors of testing. All you need to do is make an appointment by calling 858-2929. We are offering, again, molecular PCR testing, and those turnaround times are between 1 to 3 business days, and then the point of care, the rapid testing, where you get your result before you drive away. So it's really important that we all know our status, because that's where we're starting to help with our response and cut down our transmissions in our community. So I just want to call out to Erie County residents, we need your help with controlling this pandemic. We've been informed by our contact tracers that they need help getting people to come on board and work with the contact tracers to make sure that people that aren't contagious and people who are potentially contagious are not walking around in the community, going to school, going to work, and potentially infecting other people and spreading transmission. So we've been told from the contact tracers that there's some people that are refusing to cooperate and stay at home when they're in isolation or quarantine. Again, that's putting other people at risk. We know that there are people showing up to work or to school who are symptomatic, and even if they don't have COVID-19, they have something else that will make people sick. So we need you to stay at home. I acknowledge it's really inconvenient, and the weather is getting nicer. It's just like a bummer. However, we all want to bring our numbers down. If we bring our numbers down, we'll be able to open up businesses, we'll be able to get kids back in school. That's where we need to go. Also, we've been told that the people who are under investigation for a COVID-19 case haven't told the contact tracers, like everybody that lives in the house or, everybody that they work with to try to protect them against quarantine. That's not necessarily protecting people because it's putting the other people in the school and the workplace at risk of possible transmission. And also we've heard that there are a lot of outbreaks in different types of workplaces, places that you wouldn't even expect. And this, one of the reasons is because it's, I know it's really tough to enforce a masking policy, but that's what we have to do right now where our numbers are still high. So please, employers, please make sure people are wearing their masks inside, especially inside when they're around other people. So for the good news, we are making progress with our COVID-19 vaccinations. So through April 25th, there have been 47%, which is 434,755,000 received a first dose of COVID-19 vaccine, and which is 58% of all the eligible residents. And 34%, which is 312,177,000 people received a second COVID-19 vaccine dose, and that's 41% of all eligible residents. So we're getting there. We need to go a little bit further. We need to get everybody herd immunity. That's at least 70%. We need to do more. We need to do better. And so we need your help. And of what Erie County has done, how we've participated in this initiative, we've vaccinated 60,907 first doses and 47,592 second doses. And through April 25th, there have been 5,482 16 and 17-year-olds. So that's about 1/4 of our 16 and 17-year-olds in Erie County who've been vaccinated with COVID-19. But we want to get those numbers up because we want to get kids back into school and we want to get them on the field playing sports. So this is a chart that we show every week looking at what our percent of the population who've been vaccinated with the COVID-19 vaccine by zip code. And again, the rural areas are in the yellow, suburban areas are in the green, and the urban areas are in the blue. And so you can see there are significant disparities where many of our urban areas and our rural areas have much lower vaccination rate than our suburban areas. And so we're trying really hard to reach out to people. And we're going to talk about some innovative programs that we have coming up to meet people where they are. So we want to come to you and help vaccinate you. And so we are still offering our hubs, our big vaccine clinics at ECC North, ECC South, and the Key Bank Center. We're also doing pop-ups every single week, multiple pop-ups per week, and you can find all that out on our Erie County Health Department COVID-19 vaccine website. Although appointments are strongly recommended because you'll just whiz in and out after the 15 minutes observation period. If it's difficult for you to plan and you find like, oh, I have like an extra 20 minutes, I can come and get vaccinated, come on down. You can walk into any of the clinics that we have. Our main clinics, our pop-up clinics, you can just walk in if you're in the hood. If you want to schedule, you can call 858-2929 to ask questions about vaccines and to schedule our next appointment. Just to let you know what we are getting from the for the New York State Health Department of COVID-19 vaccines. So this week we've been informed that we are receiving 2,800 Moderna doses and 1,170 Pfizer doses that we hope we can get to those 16 and 17-year-olds. We've also secured some additional Pfizer from one of our local pharmacies, so we want to make sure we have enough doses to get to all the 16 and 17-year-olds. So this coming week and next week, we're going to be doing pop-up clinics in the community, as I said. On Friday, we're going to be at the Calvary Baptist Church. On Monday, we'll be at the Second Baptist Church. And then on a Tuesday next week, we'll be at the Pilgrim Baptist Church. And then on May 1st, we're doing a special pod at Rich's Products. So we just want to thank Rich's very much for letting us use their space. So that's right near Broderick Park. So we're really trying to reach out to the restaurant community and also to our childcare workers that have to work Monday through Friday. So Saturday's a great day for them to come in to get vaccinated. So please, if you work in a restaurant, we know we're seeing big outbreaks in the restaurants, people in the kitchen, food servers, and I know that you all want, restaurants, you all want your places to be safe for your patrons. So please, come to our Rich's Product site and to get vaccinated. You can, again, go online, make an appointment, call 858-2929. We really want to help you get vaccinated. We really want to make everybody's dining experience special and safe, and please come and get vaccinated. It is free and a beautiful place. We're also offering our teen vaccine clinics this coming Saturday, May 1st. We're going to have 3 clinics, one at ECC North, one at ECC South, one at McKinley High School. So we're going to be offering Pfizer doses for 16 and 17-year-old. And if they want to bring their family members, like their parents, older siblings, friends of the family that are 18 and up, we have Moderna doses for them. So we can vaccinate anybody in the family who is 16 years or older, or bunch of friends that are between 16 years and older. So please come to our clinics. They're going to be balloons and fun, and it'll be a good time because we want everybody to get vaccinated. And remember, our COVID-19 vaccines are for students, will help kids, get back into the classroom, will help them, stay on the fields. We want kids to be in school. We want kids to be playing sports. We want it to be safe, and we don't want to see transmission. So we're doing everything that we can to make sure that our kids are safe in the schools. And as the county executive mentioned, we've had, yesterday we had a big webinar with our school superintendents, and we explained that that we want to work with them to help keep the schools open and help the kids playing sports. And this is our ticket. This is the way we're going to be doing that. So I'm going to turn over the rest of the presentation to the county executive.
Thank you, Dr. Burstein. And as the doctor noted, it was a very important webinar we had yesterday. There were more than 100 participants, superintendents, deputy superintendents from all the school districts, explaining exactly what the standards are so everybody knew it's an even playing field. And I want to thank the Superintendents Association for participating. Now, we have seen a reduction in the number of first doses that are being sought by people. We had 3 first dose clinics yesterday, and not a single clinic did we break 100 new first doses. In fact, in the one clinic, we had less than 30 first doses. And we know that there is some hesitancy out there, but we also know that people need sometimes a reason to get a dose or a reason to go to the location. So we're opening up all these pop-up clinics. We're working with our partners across the spectrum to get people vaccinated. In an area of concern that we see, especially with the higher rates of cases, are those in the 20 to 29 or the age of 30 to 39, or as we were going to be addressing in this situation very soon, 21 to 29. Because we realize that a lot of the millennials and a lot of the younger adults don't really feel a need to get vaccinated. And it's sad because they can catch it, they can get sick, they can pass it on to other people. So working with a number of our partners in the local brewery community, we've come up with the Shot in the Chaser program. Anytime you can have Homer Simpson in your display, it's a pretty good day for a presentation. But the Erie County Department of Health is partnering with local breweries to hold up pop-up clinics on site and offer a free drink for a COVID-19 vaccine dose. And the first 2 breweries to participate in this program are Resurgence Brewery as well as Flying Bison Brewery. On May 8th, the first clinic has been already scheduled for Resurgence Brewery from 11 a.m. to 6 p.m. There were 300 available slots. When I left my office, it was 295. I feel very confident by the end of the day it will probably be near 0 because you come, you get vaccinated on site at Resurgence Brewing. We will give you something to present inside, and you will be able to get a free drink at Resurgence. The same thing with Flying Bison. We will give you actually a pint with our Erie County 200 Bicentennial logo on it, and you'll be able to get a free drink at Flying Bison. We're also letting the other breweries out there know we want to participate with you too. So call Jason Hurley in my office at 716-858-2827 or email him at jason.hurley@erie.gov to help set up a pop-up clinic at your location. We understand our constituents. And we know, especially in our younger constituents, sometimes they need a little incentive. And there's nothing that prohibits this. The federal government does allow providing a keepsake or some sort of other types of initiative. We just saw, I think, state West Virginia is doing $100 savings bonds. Good for them. But we believe that we can support our local brewers who've had a tough year in the last year, as well as get more people vaccinated. Dr. Burstein showed the numbers earlier. We've vaccinated a fairly sizable portion of those that are eligible. 57% of those with the first dose, nearly 50% soon are fully vaccinated, but we need to do more. And that's why I am asking people, if you've had some hesitancy or you thought, it's not worth it, I'm a 26-year-old, I'm not going to get sick, well, you might get sick. And oh, by the way, come on down and we'll get you a free brew, and you'll be able to support one of our local great microbreweries. We're looking at expanding this for other breweries in the area. Shot and a chaser. Get your shot in the arm, get a chaser of beer, and then enjoy the rest of the day. And hopefully, after you get your second dose, you will be fully vaccinated and protected from COVID-19, not only protecting yourself, but your family, your friends, your other loved ones, and our greater community. So help get on the vaccine train. And if it takes a beer to do it, that's okay. This is Buffalo. We love our beer. We got some incredible microbreweries here. So I want to thank Resurgence and Flying Bison for being the first two to participate in this program. I have a feeling they won't be the last. Once again, if you're a microbrewer, one of our local breweries, and you want to participate, call Jason Hurley of my office at 716-858-2827 or email him at jason.hurley@erie.gov. We'd love to enroll you in the program because we want more people to be vaccinated, and we think this is a great way to do it. With that, just a reminder, we will get back to normal if we're vaccinated. Concerts, travel, in-person learning, sports events, festivals, proms, and graduations. There's some schools that are already talking about if they want their proms, they got to be vaccinated. Get vaccinated, folks. We can get back to normal by getting vaccinated. Let's be the community that bucks the national trend by getting the vast majority of us vaccinated so we can reach herd immunity. If we do that, we will be better for it, and we will get back to normal. Thank you. And with that, I'd like to open it up to questions now. And we'll start, I think I've been bouncing around all over the place lately. So we'll start right from the top of my list, which is Jeff Russo of WKBW.
Executive, how are you?
I'm good, Jeff. Thanks for joining me.
Great. Thank you for your time. Two quick questions. The first, a lot are asking if the shot in a beer can be retroactive. You know, if someone else wants a frothy beverage that has already been vaccinated, can that be retroactive? And secondly, you touched on the vaccine clinics for older teen students. I believe you mentioned today some districts are requiring vaccinations to attend prom. Can you expand on that and on how that will help some students that are trying to attend prom and need to be vaccinated, and how this will help in that regard?
Well, with regards to the first group of individuals, we're not going to be able to provide a frothy beverage to every individual because there's over 400,000, but we are looking at actually providing some sort of assistance or a keepsake, so to speak. If you go to our county clinics right now, you actually get more in value from what we hand out, because we hand out a box of masks, we hand out wet wipes, we hand out smaller stuff that actually costs more for the county with regards to it than the beer. So people are leaving our clinics right now with a keepsake, so to speak, that they can use to protect themselves. We are looking at providing some sort of a gift to those who've already been vaccinated as a thank you for being vaccinated. We don't want to let people out. I don't think we're going to be able to provide 440,000 drinks through either Resurgence Brewery or Flying Bison for the future clinics that we hold, because if 400,000 people show up to get their drink, we're never going to be able to vaccinate the 350 people we'd like to do that day. But we are looking at giving a gift keepsake to thank those who actually have already been vaccinated. And for those who haven't and they're looking for a little incentive, yes, here's a good incentive. If this doesn't work, I don't know what will. But we certainly want people to get vaccinated. I'll turn it over to Dr. Burstein and talk more about the schools and the proms and graduations. We have heard, although I don't know definitively if it's been announced yet by any school district, that they are considering vaccination proms. But we think the best way to ensure that somebody can go there and it's a safe thing is to get those children vaccinated. And it's good to see that 25% of the 16 and 17-year-olds have been vaccinated, at least with one dose. That's a good sign.
Thank you. So with the new New York State guidelines for large events, including proms and graduations, for these larger events, including if they're outdoors, over a certain number, everybody either needs to be fully vaccinated. So with the Moderna and Pfizer, that is 2 weeks after the second dose, or with the Johnson & Johnson, it's 2 weeks after that first dose. However, Moderna and Johnson & Johnson are only approved for people who are 18 and up. So that's why we're offering these special Pfizer clinics for our 16 and 17-year-olds, because we really want them to be able to attend. I know some of the schools already have been proactive, and they have sent out letters to families that have students that are going to be either going to a prom, junior or senior prom, or who are graduating, letting them know that either they have to be fully vaccinated by that date, or they have to have a negative test, a rapid test within 6 hours of the event, or a regular PCR diagnostic test within 72 hours. So it would be so easy not to have to ever worry about that testing to go to a prom or a graduation and just get vaccinated. This is the incentive, and the clock is ticking. Remember, you can't just say the day before the prom, oh, all right, I'll get vaccinated so I don't have to get a test. You have to plan ahead, because for the Pfizer, it's really going to take 5 weeks to get fully vaccinated. So the clock is ticking, so come on May 1st, come on Saturday to get vaccinated. Thanks.
Thank you, Doctor. Chris Horvatis, WIVB-TV. Are you there, Chris? We'll come back to WIVB. Kelly Dudzig, Channel 2.
Hi, is there any update on the Erie County Fair with the county having to sign off on vendors for permits and everything? Any new info you can share on that?
I don't believe we've received the plan of operations from the fair. We do know the state announced yesterday the state fair will be operating, I believe, at 50% capacity. We request all these larger events to send us a plan of how they're going to open and hold their events. And last I saw as of last week, they had not. We would certainly entertain and discuss this with the Erie County Fairgrounds. We have a good relationship with them. We provide a lot of services to the Erie County Fairgrounds as well. So I just look forward to sitting down with the folks from the fair, with our Department of Health, and going through their plan of how to do it. And of course, New York State will be involved, because there will be parameters that will be set by New York State for these larger events. I would certainly hope we could have the Erie County Fair this year. If the New York State Fair is being held, I don't see why we could not, but we'd have to meet certain parameters to ensure the safety of the fairgoers as well as everybody who goes to the fairgrounds, which of course on any one day are thousands, tens of thousands. Spectrum News? Anybody from Spectrum?
Good afternoon, Mark. Can you hear me?
Yes, I can. Go ahead.
Okay. Yeah, with the CDC now saying that if you're fully vaccinated, you can take your mask off at small outdoor gatherings or when you're dining outside with friends from multiple different households, how do you think that this is going to affect people's behaviors, especially with the warmer weather coming even this week?
Well, backtrack though. The CDC said you could do this as long as everyone from multiple households have been vaccinated. That's my understanding.
Did I not say that?
No, you didn't. So
they need to be fully vaccinated?
No,
Yeah.
You just said could take their masks off outdoors in multiple households. I think it's important that the CDC recommendation, which we think is a fair one, and one is we're recommending as well, and saying if you're with individuals who've been fully vaccinated, even if they're from multiple households, you can take your masks off. That makes sense. I would certainly hope that would give further incentive for individuals to go and get vaccinated. As we mentioned last week, Israel got rid of its full outdoor mask ban or requirement to wear a mask because there were over 80% of all Israelis had been vaccinated. So I think it's a good point by the CDC that if you're around others who've been vaccinated, you can take your mask off. But if there are people there who are not vaccinated, you still have to have your mask on. So it reminds everybody why you should get vaccinated. So when you're outside, hanging out at your friend's house, having a barbecue, having a brew, hopefully the EC200 brew, which will be coming soon, you'll be able to do it with your friends without wearing a mask during the whole period. But if people haven't been vaccinated, then you got to wear your masks. Why? Because the unvaccinated ones are higher risk for illness, and we just want to protect everybody so we don't add to that hospitalization and death toll. Go back. Is Chris Horvatis there, Channel 4? Chris Broadbent, is he available or no? Is he muted? I don't know what's going on with Mr. Horvatis. Maybe he can
Hey,
text.
Mark, can you hear me?
Ah, there you go. Go ahead.
There we go. A year into this, you'd think I know how to press *6 by now, but you give me too much credit if you think that, I guess.
We all do it.
So we're seeing this shift away from a focus on mass vaccination sites to more pop-up sites. Are we going to see these mass vaccination sites at ECC and the arena go away entirely at some point in the near or distant future? And how do you folks strategize what to target with these pop-up clinics now? You know, we see this Shot in the Chaser program. We see you targeting restaurant workers at Rich Products in a week. How do you decide where to target now?
Well, we're probably still going to have central hub sites because remember, we also did first doses there previously, so we have to offer the second dose there, especially for the larger amounts. For example, yesterday we did over 900 second doses at one of our ECC sites, and I think we did 50 first doses. We could always move those second doses to another location, but we're still going to have those mass sites for a while because we have to finish the doses that were given 3 weeks or 4 weeks ago for the first dose to the second dose. So we are going to be keeping those, but eventually I would imagine we do plan on pulling back on using those sites and using more specialized sites. We've already talked about other county locations that we have that the health department controls that we potentially could use as first dose locations, but we want to bring it in the community. You're going to be seeing more pop-up locations where we accept walk-ins, including in the parks. We know a lot of people use the parks in the summer. Got a big old parking lot at Chestnut Ridge Park. We could set up our mobile unit right there, so if somebody wants to get vaccinated, they can walk right up. That makes a lot more sense if we have the Johnson & Johnson vaccine, where we can do the one and done. And while it's been approved yet for reuse, we don't have Johnson & Johnson to give. So once we get more Johnson & Johnson, that'll make much more sense in the summer. But because we've vaccinated such a significant amount of our population, 57% have received at least the first dose. If we continue down that trend, and I'm hearing the second dose returnees are very high, so we're not seeing what they're necessarily seeing in other part of the country where people are not coming back for their second dose. We have the 99% of them are coming back and getting their second dose. So I think we're going to get to 60%, no problem. It's getting from that 60 to 75, 80, I think that's going to be an issue. So we're going to go out in the communities. We're planning a pop-up clinic right now in southern Erie County. I don't want to announce the location because we're still working with the town and I don't want them to get inundated with phone calls and we don't have the date set yet. But we're going to be doing one in far southern Erie County with one of our towns. We did a pop-up clinic in the town of Eden and went great. We're going to be doing another one in another town. So we're going to be moving them around. We're going to have specialized locations where we only have maybe 2 vaccinators instead of 7 or 8 so that we can do more in a day at these smaller locations because we realize the only way we're going to be able to hit everybody that we need to is if we bring the vaccine also to them. Okay, WBFO radio, is anyone on?
Yeah.
Go ahead. Michael, are you still there?
Oh, back again, yeah.
There you go. Back again.
You talked about Salem last week and that you don't have control of the baseball stadium. However, Dr. Burstein does. So what kind of restrictions are you likely to have when a certain Major League Baseball team from just north of here shows up?
Well, first off, Governor Cuomo increased, I believe, stadium crowds of 33% yesterday, which is very helpful. It increases the number of people who could be at the stadium to watch a baseball game. We have had conversations with the Buffalo Bison's organization and others from Major League Baseball for more than a year now, but of course, because we were dealing with the Blue Jays being in Buffalo last year. And I don't want to put cart in front of the horse, but we continue to have conversations with all of our partners in professional sports to ensure that they are all safe. The difference with Salem Field is we do not own it. We do not control it. Yes, there are standards that can be set by our health department, but we also have to respect the ownership interest that exists otherwise in this situation here in the city of Buffalo. So we want to ensure that we get as many people in these facilities as much as possible. We know we can do that safely. with the football stadium and hockey arena, because the county owns it, with everyone being vaccinated. If they're not vaccinated, then you have to go to the lower levels, because you're also going to have a chance that individuals there are unvaccinated, even if they just got a PCR test, and they can catch the illness and get sick. And that's what we're trying to prohibit. Mike Baggerman, WBEN.
Hey, Mark, I want to get your opinion on the way that Governor Andrew Cuomo is characterizing the positive test rate for Western New York. You've heard him over the past couple of weeks saying that we're not taking the virus seriously, and that's why we have the high rates we are. But, you know, you look deeper into the numbers, and our vaccination rate in Erie County is higher than the statewide average. What do you make of the governor's characterization that we're not taking it seriously out here despite the vaccination numbers?
Well, I'm not going to talk specifically about the governor's characterization, but I am going to note he, like the rest of his team, talking with the lieutenant governor, are concerned about the individuals who have not gotten vaccinated in this area, as well as the increase in cases. We were number one in New York State, and for a while there, we basically were number one in the Northeast. We love saying we're number one. The problem is we were number one for new cases and rising hospitalizations, and sadly, deaths as a percentage of our population. So I understand why the governor was concerned. We did have a problem. It is going down. We are still higher than we'd like to be. We want to be below that 100 new cases for a 7-day period per 100,000 residents. I believe we can do it. We're starting to see major drop-off in certain age groups, but we are still seeing it in our younger people and our people aged 20 to basically 39. So without going into the governor's specific characterizations, I think it's important to note he, like the lieutenant governor, like myself, like others, we're concerned about these rising numbers in Erie County. We have a higher vaccination rate than the rest of New York State. That is true. We actually have a higher vaccination rate than the national average. I'm happy about that. I want to be as high as we possibly can be. But as long as 40%, 35% of the population has not been vaccinated, we are not going to reach herd immunity, and we're going to have individuals who are at risk for getting very sick and dying of COVID-19. 60 individuals died of COVID-19 in April, through April 22nd. 60 individuals died of COVID-19 throughout the whole month of March. We have these strong variants out here that are much more transmissible, and people are getting sick. I gave my best wishes to Ted Shred of 103.3, who's in the hospital, as was reported by the Buffalo News, dealing with COVID. And he sounds pretty sick. And he had gotten his first dose, but it looks like he actually caught COVID-19 just before his first dose. So the sooner you can get vaccinated, the better for yourself and others. And to Ted, I certainly wish you well. I've always enjoyed going on the show with you and Tom. And I certainly hope you have a very quick and full recovery. I know people out there, people I know who are long haulers who are still dealing with the illness, even though it's been months since they had the actual live active virus in their system. So we want to remind everybody, this is not the flu. This is a serious virus that has killed thousands of people in New York State, about 1,800 people in Erie County, and a number that is still unfathomable for the United States to have lost hundreds of thousands as we had. So I don't want to see anybody else die. Please get vaccinated. Sandra Tan, Buffalo News.
Thanks, Mark. So regarding your shot in the chaser program, after a person gets their first dose of the vaccine and gets their free drink, they still have to get their second dose. So would they go back to the same brewery or bar or restaurant to get their second dose and get another drink ticket? Just curious to know how that works. I'm also whether or not it's open to any bar or restaurants that might also want to participate, or is it just breweries?
Well, first off, we do working with the breweries. We anticipate it would be both doses, so 2 drinks, which is a good thing. And then we certainly hope that people would stay and patronize at the local brewery, enjoying the fine spirits that they have there, as well as a nice meal. And when it comes to other locations, we certainly are interested in dealing with others. There are limitations on what we can do. We certainly aren't going to go just to every location or bar that requests. We want to also highlight our local brewers. We are willing to work with restaurateurs, but we also have to have, in some ways, a guaranteed number of individuals. I'm hoping that we fill out the block associated with both of these that'll be coming up. The one on May 8th, which we announced for Resurgence, and the one for Flying Bison, which we'll be announcing the date very soon. Our goal is to get as many people vaccinated. We know we have a problem with millennials. We know we have a lot of problem with people who like to frequent the locations because brew pubs and breweries because they just don't think they need to do it. And if this gets another 600 or 1,000 people vaccinated, we're all better for it as a community. As I said, we're already giving away at each location basically the equivalent of $10 worth of PPE supplies. You get a box of 50 masks, you get a box or a packet of a wet wipe, a disinfectant, and you get one of these, which we got free from New York State, but the other stuff we've purchased. So we've been giving away stuff all along. You're seeing some other things. I saw Adam Bello in his Department of Health in Monroe County was giving away free hot dogs to go to a Rochester Red Wings game. We're talking over with other businesses about other types of gifts that could be given to promote not only our local businesses, but get people vaccinated. And our goal is to do that with as many people as we possibly can. And if it's a shot and a chaser that gets somebody to get vaccinated, I'm happy about it. And along the way, hopefully they'll continue to support our great local breweries. Associated Press. Michael Kill, or is it Vil? Hill. Michael, are you there? I guess we answered his question. Very quickly, we'll do the rapid fire round. I've got to get on gotta be out very soon. Channel 7, any more questions? Jeff Russo.
County Executive, thank you.
Okay, thanks, Jeff. Chris Horvatis, any more questions? Channel 4.
Yeah, so the governor just announced that aside from the state mass vac sites, local county vaccination sites can do total walk-ins. I know Erie County's been allowing walk-ins for the last couple of weeks. Is the difference, though, that just the clinics haven't been total walk-ins, and would total walk-ins be something that Erie County would do in the near future?
Well, the funny thing is we can't do total walk-ins because they're not giving us enough Pfizer to do 16 and 17-year-olds. So I'm not exactly certain what the governor's talking about. I'd have to see. And for some of these restricted pods, like we're only going to have a certain number of vaccine doses at these sites. So for the shot and the chaser sites, if we have 300 doses scheduled and we fill all the slots, we're not going to be able to accept another 1,000 walk-ins. So I'm not exactly certain what the governor's talking about. And we are getting a very limited supply of 16 and 17-year-old, Pfizer's for the 16 and 17-year-old. I'd be very disappointed if a parent came with their child to get vaccinated at one of our other sites and we didn't have vaccine to give them, and they came because the governor said they can walk in. We've been talking about walk-ins for a couple weeks now. I think people understand that there's a very limited amount of individuals who are walking in. And I'm glad the governor's doing that in the grand scheme of things. I don't think it's going to affect anything that we're doing here. And I would not want to say everyone can walk into any site, because if we don't have Pfizer at that site, we're not going to be able to do 16 to 17-year-olds. And as these situations like we are doing with the shot and the chaser, if we have 700 people show up and we've had 300 appointments or 350 appointments and they're all full, we're never going to be able to do the rest of them because we bring a crew that's the appropriate size to vaccinate 350 people. Kelly Dudzig, Channel 2. Any more
How's
questions?
the effort going to reach homebound people? I know it's a challenge without having access to the J&J vaccine.
It is a challenge. We have shared some of our Moderna shots with two of the agencies that we work with, VNA and Buffalo Home Care. It is much easier with the J&J shot, and now that it has been approved, or at least was recommended for approval, hopefully we'll be getting more again soon. But it is. The doctor said we have some left over. It's not a lot though, but we are sharing those once the approval starts. We'd much rather have full J&J to give to 600 homebound than have to do a Moderna out and then come back 4 weeks later to give them another dose. Spectrum News, Tony, any more questions? Mike Desmond, WBFO, any more questions?
Yeah, there is a vocal local protest group, demanding that the schools be opened and so forth. And I can't imagine there are very many parents who are opposed to all the kids being back in school. There are certainly some. But what do you say to parents when they hear something from you, they hear something from Dr. Burstein, they hear something from the people on this particular group? How can a parent figure out what's going on?
Well, I think it's important for parents to listen to trusted sources, CDC, Dr. Fauci, Dr. Burstein, We had a very, very good conference call, webinar, in which we shared information by PowerPoint presentation with the school districts yesterday. We are sharing it with them. They should certainly talk to their doctor. I am aware that there's a significant portion of parents who don't want to send their kids back to school just yet 5 days a week, nevertheless 1 day. And that's in all school districts. Not every child has returned. Some children have higher needs, immunocompromised issues, where their parent is afraid, and probably rightly so, of putting them in a school where they're coming in contact with hundreds of other students who may actually, some of them may actually have the illness. So there's not 100% agreement on this. I've had just as many parents or more come up to me saying, keep up doing the right thing. We understand there's a very vocal minority out there, but they don't represent everyone. We all want to have children back in school, simple as that. We all want them to have back in school. If you get once they approve vaccines for all children, the best way to get your kids back in school for the fall, 100%, 5 days a week, is for them to be vaccinated. Right now, only 16 and 17-year-olds can be vaccinated, and we're trying to do our part to ensure that they are vaccinated. And if somebody wants to vaccinate their 16 or 17-year-old, we have those 3 pop-up clinics, teen vaccine clinics, and we want to vaccinate these children. Mike Baggerman, WBEN.
Hey, Mark, I know you guys haven't run into the issue yet with these walk-in clinics in terms of running out of doses, but hypothetically, as you start to open them more, what would you tell somebody if they come to one of these clinics and you're out of doses?
Well, we have had a situation or two where somebody's come late at night as we're closing the clinic, and we've allocated all of our doses by vial, and then they show up and they say, hey, I'm gonna walk in, I wanna get it, and we tell them, no, we can't, because we have to break another vial, which means if it's the Moderna, or excuse me, the Pfizer, we've gotta find another 10 people to vaccinate in the next 5 minutes. So we have had that situation. It's very few and far between. Usually we will reschedule that person. We'll set up an appointment right there for either the same location or somewhere else so they know they're gonna get it. I don't know if we're gonna run into that problem as much as we think, because we're just not seeing it, the amount of walk-ins that would put us in a situation where all of a sudden we got another 300 or 400 people coming. Our concern right now is the individual who shows up at the end of the clinic who wants to get vaccinated, and we do not want to break open another vial to then have to use that whole vial up by the end of the night when we know we would not be able to do it, because then we have spoilage and we'd have to throw out the doses. So I'm more worried about that than getting a mad onrush of individuals. I'm hoping that when it comes to the shot and the chaser plan, we see that those appointments are all used. And if they are, we'll announce. We can't accept any more for the resurgence or when we do the Flying Bison. We'll be doing more of these in the future. And if this is what it takes, great. But if it doesn't work, it doesn't work. In the meantime, we'll have gotten more people vaccinated, and that's what really matters. Sandy, you'll have the last question.
Thanks. You have received a lot fewer Moderna doses aside from Pfizer, and this week compared with previous weeks, and I'm wondering if that's just because you don't need more. Is it just that you're not using up the ones you have?
Yes.
And so you're not getting as much new as you had before?
Yes, I think we had 2,000 doses approximately. Doctors give me the head bob, yes. We remember, you used to give us the 7-day, I don't think we talked about this, we had to use it in 7 days or lose it. New York State withdrew that. That was stopped last week because we weren't the only ones that were not going to be able to use our allocation in a 7-day period. So we had about 2,000 additional doses left over from last week that were in the freezer. We didn't have to worry about them being spoiled. And so as a result, we didn't request as many. Why would we request the full amount if we have 2,000 doses sitting here right now anyway? So we are getting that amount we talked about earlier, which is a lower amount, but we still have another 2,000 doses that we had left over from last week. And we're only going to request the doses we think we need. We're not going to ask for additional amounts if we're not going to be able to use them. So I'm glad New York State stopped the use it or lose it rule within 7 days, because it actually gives us an opportunity to keep those doses on hand, and therefore we can use them as we get appointments or walk-in clinics as necessary. And if by chance we're running out of doses and we still needed more, we would talk to our partners like we did with one of the local pharmacies to get more than 1,000 Pfizer doses, and talk to some of our other partners out there who may be sitting on doses if we needed them for a clinic the next day. But yeah, we've had a slowdown, And that slowdown has affected the amount of doses we put in arms, and as a result, we didn't need to ask for as many for the upcoming week.
And does that apply just to Moderna or both Moderna and Pfizer? You just don't need as many?
Well, we would like more Pfizer because we could do 16 and 17-year-olds then.
Okay.
So if we had a choice, we would, between Moderna and Pfizer, we'd take all Pfizer because it's a little easier to dispense as compared to the Moderna. And the other thing is we can use it from 16 and above. And the final thing is you get your second dose in 3 weeks as compared to the Moderna, which is 4 weeks. Did I say that right? I think so, yes. It's been so long, I've done this so many times, I don't want to confuse. So we'd much rather have Pfizer, actually, because we can use it for the 16, 17-year-olds, everyone above. We're hopeful that the FDA approves Pfizer for 12 to 15-year-olds, which then, of course, there'll be a mad rush to do a lot of 12 to 15-year-olds. And it has a shorter time period between 2 doses, so you can get full vaccination protection quicker with the Pfizer. Okay. Thank you to media. I appreciate you all participating. This will end today is the 27th. I was going to say 24th because I kept on talking about the 24th earlier, but it's April 27th. And I am very pleased to see the numbers going down, both of new cases and hospitalizations. I am very pleased to see our numbers with regards to vaccinations, but we're not where we need to be yet. We still need to be higher. Remember, Israel got rid of its full mask requirement for outdoors for everyone. They hit 81% of their residents getting vaccinated. Right now we're in the 57% or 58% category, so we're not where we need to be yet, which is 1 dose. Only about half have been fully vaccinated. I feel good about where we are, but we need to be better. So please be safe out there, wear your masks when you can, otherwise safely socially distant. If you're around other individuals who are fully masked, you can take off your mask if you've been vaccinated. So to Kendra, thank you for your great work doing the American Sign Language. Same to Dr. Burstein. To the group we have here, Chuck and Monica manning the presentation, Dan Meyer, Chris Broadbent, and Derek G. Thank you all for being here. I appreciate it. Until I talk to you next week, be safe and well.